For those of us in primary care, we know that heart disease is the #1 killer of American adults in this country. And so how do we identify those patients that are high risk? Well, the new 2026 Dyslipidemia Guidelines came out, and so there's really 3 points that I want to make. I'm Dr. George with CME Travel Academy. We teach CME, and one of the things that we talk about is the latest heart disease guidelines. So, first point. First, it's called a CPR framework. Number 1, C is for calculate. Calculate their 10-year risk score. So use what's now called the prevent risk calculator, which replaces the old pool cohort equation, to calculate the patient's 10-year risk score. You can then determine if they're low risk, in which case you just treat them with lifestyle interventions. If they're high risk, you want to start them on lipid lowering treatments. And then for those patients who are in between, we have to decide whether we need to treat them or not. So those patients, we look at the second thing, which is the P in CPR, personalize that risk to that individual. And how do you personalize it? By looking at all the other factors beyond what's included in that risk calculator. So beyond what's included in the prevent risk calculator, such as whether that person has a family history of heart disease, whether they're from a high-risk ancestry, perhaps it was a person who underwent early menopause or have some sort of rheumatological disorder. These are all elements that increase risk. You want to incorporate that into your thinking. And then finally, the R, CPR, that third component is R for reclassify. Get a coronary calcium score, coronary artery calcium score, to help reclassify those patients. You could then determine if that score is 0. For a lot of those patients, they can be down categorized. So if they're in that in-between risk category, whether that's borderline or intermediate, you could potentially bring them down a risk category, assuming that they don't have certain other high-risk conditions. But if it's positive, then you're going to start them on lipid-lowering therapy and, of course, address all their lifestyle interventions and encourage a healthy exercise routine as well. Thank you. I hope you enjoyed that. I hope you guys will come out and learn more from us at CME Travel Academy about chronic coronary disease as well as a number of other chronic coronary conditions. Thank you.